2-year-old suddenly convulsed whilst waiting to see the nurse. The mother, out of fear, panicked and ran away thinking her child was dying. Elizabeth Coker, commonly called Nurse Betty, a maternal and child health aide, was quick together with her staff to save the life of the little girl. This is one of many cases the Malama Community Health Post deals with on a daily basis. The Malama Community Health Post was founded by Nurse Betty in 2009 because of the number of pregnant women who were dying while giving birth. She started off with a structure, and with the help of NGOs like the Red Cross and community people, with support from the Ministry of Health and Sanitation, she has been able to expand the facility to accommodate a good number of people from surrounding communities.
You see that Belon Marika?
The pregnant woman who just came in is from a far community where there is a PHU in the community. She shouldn't come this far, but I still get people from Amulti, Kamayama, Godrich and other areas. There are health centers or posts in those areas, but pregnant women still come to us.
They can let you talk to them and say, when I go to that area, they're not agree for go.
The little girl's mother later showed up in tears of joy, with her husband happy to see that their daughter's situation has improved. She slept soundly on her father's shoulder, ready to go home. Minutes after that incident, a young pregnant woman rushed to the health post to deliver her baby. We were lucky to witness the delivery. Nurse Betty has retired now, but her daughter, who is a trained midwife, is in charge of the center. The health post has 3 qualified staff who are on government payroll, 3 traditional birth attendants and few volunteers. Bompose Sila is a traditional birth attendant and has been helping out in this health post for over 8 years. During the day, she occupies herself in the garden, where she gets some money to feed her family. She says when pregnant women come to see her in the house, she sends them to the health post for safe delivery.
When a pregnant woman is in labor and goes to my house, I refer her to the health post because sometimes most of these women bleed after giving birth. This is a case for specialists. I no longer deliver in the house. I send them to the hospital and help deliver their baby.
Anybody come to me, I refer to.
Most pregnant women shy away from going to referral hospitals or health centers because of how some nurses normally respond to them. But Bale Dumbuya, who lives along Regent Road, Lumley, had complications during her second pregnancy. She says nurses at the health post know how to handle such cases.
The first Bele, they treat me well.
When I was pregnant with my first child, a friend told me about the good work of the nurses in this health post. I was scared at first because it was my first pregnancy and I had complications, but the nurses on arrival comforted me and allayed my fears. I eventually gave birth without any complications.
I born as safe, then deliver me as safe.
The Malama Community Health Post is gradually growing in terms of facilities. Even though NGOs like the Red Cross provided them with water and solar panel, maintaining the facility is also a challenge. Abu Conte is the Chief Community Health Officer in the Ministry of Health and Sanitation. He says the ministry now has a new plan which is underway for PHUs in the country.
New budgets have already been provided now to make sure that even laboratory facilities are provided in every chiefdom so that minor tests, for example, blood testing, HB, HIV, TB, this can be done in our PHUs now at every chiefdom, and whatever comes out of it, treatment can start right from there.
In the Western Area Rural District, the District Health Management Officer is responsible to monitor and evaluate and also make recommendations on the assessment of PHUs. Dr. Sylvia Fasuluku Wusman is the DMO for the Western Area Rural District.
One of the things actually affected by the PHUs is actually stock out of drugs, but that will be addressed shortly. Another thing as well is staff. We have low number of staff and also the capacity of the staff to provide services. Another thing affecting PHUs is also equipment. Equipment, some of them don't have laboratories or other amenities that the facility may need.
The Newton Community Health Center falls under her jurisdiction. Fatmata Koma is the Community Health Officer for the center. This health center has basic facilities. Fatmata Koma took us around on a tour of the facility.
The more common disease condition in this community, we get malaria.
The more common disease in this community are malaria, typhoid, tuberculosis, STIs, pneumonia, and a lot more. We cater for all cases except operational sites or transmission cases.
Even except operational site or transmission, I'm not able.
This facility has a staff quarter which makes it easier for nurses who are posted in the community. Sometimes nurses who are posted in rural centers or health posts don't show up for work because of issues of accommodation. This situation, according to the Chief Community Health Officer in the Ministry of Health, will be a thing of the past.
Not all facilities even have accommodation facilities. It is now we are coming up with a policy that whoever constructs or establishes a health facility, you must provide accommodation for the service providers. So the new plan of our current minister is that we're now going to even identify nurses to be trained in their own chiefdom.
There are some health posts in hard-to-reach areas which lack basic facilities, lack of drugs, and non-availability of qualified staff. PHUs are instrumental in efforts to scale up proper package of cost-effective interventions aimed at achieving the UN Millennium Development Goals. If Sierra Leone is to move from the bottom rungs of the UN Human Development Index, it needs to make significant progress in achieving Goal 3 of the SDGs, which is to ensure healthy lives and promote well-being for all at all ages. If this is to happen, our decision makers need to ensure that health facilities in the country, especially the PHUs, provide improved and efficient services. Primary health care at community level continues to be a challenge in the society. Lack of drugs, non-availability of qualified staff, and equipment are the key challenges they are faced with. If given the support they require, they will help reduce high infant and maternal mortality rates. Sierra Leone remains one of the countries with the highest infant morbidity, though children under 5 are supposed to enjoy free health care. Reporting for SLBC, Hawabari, Newton, Western Area Rural.